there's this notion that teaching hospitals or federal medical centers in different states, they're like death sentence to people that are sick. Where I trained, the teaching hospital and the federal one at that. And then people around that area, once they hear, oh, you are going to the hospital, they say, you don't finish for that person. Like, he's definitely not coming back. Like, at some point, I was wondering, like, what's going on? Like, why this narrative? You get? And then I started traveling to other places, other states, and it's still the same narrative. So I actually took out time and started analyzing things, and I also reached out to some of my consultants and chiefs and all of that. What is really going on is that most of these patients that they tend to bring in to teaching hospitals, federal medical centers, and all of that, most of the times, these patients, they are already quarter to go. They are already quarter to go. Before you know, they will now send referral, and then at the end of the day, the person will come and die in the teaching hospital or federal medical centers. And then people will say, we talk am now. Shey we talk am, say the person will not go come out. You get? Now, that's the narrative, but these persons will know. I remember when I was doing surgery posting some years ago, I used to be under this consultant, and we had an emergency, and then before you know it, we got into the theater, we saw that they had cut this person's body. The consultant rejected it. He said, no, take this person back to where the person is coming from. Because that's the narrative. The relative of that patient now will go about saying that, yes, now the teaching hospital, the person for die. We talk about teaching hospital, they know they come out of you get? So that is the narrative. If many of these private facilities or people, hospitals outside, they get to refer the patient on time, or even you as the patient relative, you get to bring this person on time. Trust me, this narrative will not be the same. That's the truth, because I've gone around most states and I found out that that's the same narrative. Where I am currently now, you see people say, if you go teaching hospital, you don't finish for the person. And I'm like, what's going on? Now, what's the solution? It's not just about rounding, right? The solution is also what matters. Now, have you taken out time to really look at health centers, the primary health centers? Let's take it from primary, secondary, and tertiary level of healthcare. Now, those primary health centers, they're all dormant. Nothing is going on there. So imagine the government funds these primary health centers and they are working, and then you even get to have like at least one or two medical doctors covering those health centers. Trust me, it would make a whole lot of sense. Now, it will cover job employment at the doctor's level. Now, you will get a better treatment. Some of these illnesses that get to come up front, if they are being tackled at the primary level of healthcare, trust me, it won't even get up to the point of becoming an emergency. That's the truth. Then imagine the government create hospital, a standard hospital in at least 1-2 local government, or at least 1 or 2 in covering like 2-3 local governments in a particular state, span around the full state. Trust me, do you know what that is? A case comes in that the health center cannot handle, they refer to that hospital rather than thinking of going to the teaching hospital. And then if these things can work like this, trust me, before the case gets to teaching hospital, at least the patient has been managed through the primary, secondary, and then the tertiary level of healthcare. And then this whole case of teaching hospital, now they die, would not be the narrative anymore. But most of these private facilities won't tell you this. And even the people, the grassroots people, they won't even know this. How can they even know it? So that's the truth. So let's stop criticizing these teaching hospitals, federal medical centers of states, saying that that's making it look like a death sentence. Do you understand that? Once you don't go there, they come back home. Really? Have you also looked at severe critical cases that these teaching hospitals get to handle that the private parastatals or private facilities can handle? Have you looked at it because of the manpower, the knowledge base, the equipment? Have you looked at these things? So the narrative of teaching hospitals being death sentence, please, we need to stop it. Nigerians, we can do better. Call on the government. Let's equip the healthcare center. You go to a healthcare center now, you won't even see. There was one I went to the other day. The nurse was not even around. We had to wait for almost 30 minutes. And you can't fault the woman because it's not even functioning. Imagine a doctor covering 1 or 2 doctors covering one health center, and then you have health centers around. Many of these medical conditions can be handled at that level. And then if it gets worse, then the government can build at least one hospital that will serve 2 local governments or 3, if they can't even build one in each local government, which is supposed to be the ideal thing. And then if those hospitals can't handle the case, they immediately refer to a teaching hospital where we have consultants to senior registrars, to the junior registrars, or to the registrars, then to the medical officers, then you have the house officers, and even the medical students. So what are we saying? So please, let's stop the narratives of making teaching hospitals look like a place where they declare death sentence and all of that. The narrative is becoming too much. So please, let's stop the narrative. If you know you have an illness that you feel you are disturbed or you feel perturbed about, come to the teaching hospital from the beginning, and trust me, you get an wholesome care. Teaching hospitals, they treat you wholesomely. They send consults to all the units. As per private hospitals, that some can be so mean that they want to be God over you. It's even these few specialist centers that would outsource the specialist. Do you understand? So please, let's stop this narrative of declaring teaching hospitals or federal medical centers like as a death sentence. It's wrong. It's wrong. It's just the way the things are happening. The people, they are not being carried along. Let's stop the narrative. Federal medical centers, teaching hospitals, they're not death sentence. In fact, that's where ideally you're supposed to get the best level of care, because all the specialties as regards your condition would attend to you. That's the truth. No gazao. Ideo.
Your focus in life is to keep doing until the right person sees what you are doing. You know, understand? Success is for those who are doing, not those who know how to do it. Write this in the comment section for me, please. Success is for those who are doing, not those who know how to do it. You know, understand? At the end of the day, you have this wisdom, you get this information, you get the knowledge, but are you doing it? No. At the end of the day, that's why I'm better than you, because I'll keep doing. Actions over emotions.